Well, welcome everybody to the first presentation in FRSA's Spring Lunchtime Webinar series, Socially Connecting During a Socially Distancing Pandemic. My name's Robin Clough and I'm Manager of Policy and Research here at FRSA. I'd like to acknowledge the traditional owners of the lands on which we are all respectively joining from today. I'm joining from the lands of the Ngunnawal people, and it really is a privilege to live and to work on this land. I pay my respects to elders past, present and emerging, and I'd like to acknowledge First Nations people joining this webinar today. Well, I'm really delighted to introduce Louca, who will be talking to us today. Lucy's a counsellor with PRONIA, which is based in Victoria, a community services organisation with 50 years experience in culturally responsive service delivery and the implementation of innovative programs to the Greek and broader culturally and linguistically diverse communities. We do hope to have a few minutes at the end for questions, so please do put forward your questions using the Q&A function or the chat function. Well, Lucy, welcome. Over to you.
Hello, Robin, and hello to everybody. And thank you for the opportunity. Thank you to FRSA for putting this lunchtime webinars on. So I'm really honoured to be part of this program. I would also, before we start, I would also like to acknowledge that I am talking to you today from the traditional lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to elders past, present and emerging. So as Robin said, I'm Lucy Louca. I am a counsellor with PRONIA, the Australian Greek Welfare Society. And PRONIA is an ethno-specific organisation catering to the needs of the Australian Greek community of Melbourne and Victoria, and increasingly to the wider community. The title of the presentation today is Socially Connecting During a Socially Distancing Pandemic. So PRONIA was established in Melbourne in 1972 when it was known as the Australian Greek Welfare Agency, and the aim was to support a wave of newly arrived Greek migrants at the time. And this was the initiative of a group of volunteers that who had settled in Melbourne in a previous migration wave in the 40s and 50s. This year marks the 50th year anniversary of PRONIA. In 1972, the first year of its operation, as a purely volunteer organisation, it assisted just over 1,000 newly arrived Greek migrants to settle into the new country. At the end of the last financial year, as an organisation of 200 employees and 121 volunteers, we provided services to 8,500 community members seeking culturally responsive assistance. As a simple dictionary translation of the word PRONIA will give you the word providence, a form of care and protection. But of course, a simple translation does not fully convey the full meaning of the word as it is understood in Greek. It encompasses not only care and protection, but also advocacy, welfare, looking after. And this is at the heart of what an ethno-specific organisation such as PRONIA offers. It's not simply a translation, but a deeper understanding, sensitivity, and knowing of the needs of its client base. Our services at PRONIA span across all ages and include the Alpha Early Learning Centre, providing Greek bilingual and multicultural childcare and education since 1977. We also have the Family and Community Services Unit. This was the original focus of the organisation in its infancy, with migration and settlement issues the main concern. Today, our services and programs cover much more, and I will talk about that in a few minutes. And then we also have arranged and coordinated care services, including NDIS. Prior to the pandemic, like all other organisations similar to PRONIA, all our services were delivered in person, and that ranged not only from home care and respite, but also social groups, seminars, information sessions, drop-in service, counselling, home visits, and more. But then, of course, March 2020 came along. I'm not sure how much of it you remember, but it was not a good month. The coronavirus pandemic had well and truly arrived. The first round of restrictions and lockdowns were imposed worldwide, and our lives would never be the same again. The pandemic disrupted every single one of our services. And of course, this was not unique to PRONIA. We were all on the same boat. But for those of us in Victoria, it felt like our boat was sinking. For most of the first 2 years of the pandemic, it felt like we were separate from the rest of the country. As an ethno-specific organisation, we had additional challenges to deal with. Our primary cohort was 75 years plus, with less than a basic grasp of the English language. A large proportion have little or no education. There was no digital literacy. While the rest of the country and the world was pivoting to online programs, our choices and our options were very few. So how do we connect with this vulnerable cohort when all the messaging was about keeping distance, staying in, isolating, and protecting yourself? This is all everyone was hearing. While every part of our organisation faced its own challenges in this regard and launched its own initiatives, I will focus on the Family and Community Services Unit and how we were able to extend our services to our clients during this period. As you can see from the list here, our services are quite extensive and cover casework, access, support and advocacy, crisis intervention and emergency relief, counselling and mental health, settlement services, community engagement, family violence and elder abuse, project work, digital literacy, carers, and a whole lot more. So what did we do? Well, we picked up the phone, and in some ways this was straightforward, but also not. As for many other organisations, the telephone was our first tool, a relatively easy pivot, given that everyone had one and more or less could use it. Not necessarily easy for everyone, especially those with hearing issues or mental impairment, but nevertheless the only safe way to keep connecting with clients while remaining socially distant. And for the vast majority of our clients, by telephone, I mean landline. To say there was confusion, fear, panic, and uncertainty in our community is an understatement. Clients were not sure what they were allowed to do and not do. There was sadness about the loss of contact with family, worry and fear about their own health and safety, as well as for their children and grandchildren, and for many people, for family overseas. And also in Melbourne in particular, the daily COVID positive cases and number of deaths were high and scary compared to the rest of the country, though low by world comparison. PRONIA's role in the community was crucial, especially since in those early days of the pandemic, there was little, if any, translated material available from official sources, either state or federal. The major themes that emerged very quickly through our initial telephone contact with clients were fear, loneliness, loss of social contact and isolation. And this was in line with Vic Health's Coronavirus Victorian Wellbeing Study, published in December 2020, following the second pandemic wave and lockdown. After the first lockdown, the study found that 37% of Victorians felt connected to others. After the second wave, there was a marked decrease to only 31%, so less than 1/3 of Victorians felt connected to others. 2 in 5 found it hard to stay connected with friends and family during the second wave. We're fairly certain that the stats within our own particular cohort were much worse than this. We didn't have these figures at our disposal at the time when we were immediately responding to our clients' needs, but we had enough information from our own interactions to respond appropriately. At the same time, increased calls for help continue to come through casework, the first point of call for new inquiries. And the calls range from emergency relief to mental health issues, migration, housing, family violence, elder abuse, counselling support, and much more. In the financial year 2020-21, the casework team assisted approximately 5,000 clients. That was more than a 200% increase in demand. And in the same financial year, there was a 57% increase in counselling sessions. And this was largely connected to the impact of lockdowns and the pandemic in general on individuals' mental health and capacity to cope day to day. Previous tools they had at their disposal to manage their mental health were no longer available or sufficient, and in many cases, traumatic experience from the past resurfaced, catching many people unaware and unable to understand what was going on. It soon became obvious to us that there were many more people out there who were suffering through isolation and lack of any social support. For many who were already isolated, this intensified, as even the limited social contacts they had were eliminated altogether. No church, no social groups, no casual conversations at the supermarket or the chemist, as everyone was masked and trying to keep away from each other. Video calls, FaceTime, Zoom, emails, or text messages were not an option for 99% of our clients. So the telephone remained our only tool. By August 2020, given that the only tool we had available was the telephone, we established 2 telephone support groups that were running every week to meet the need for more social interaction. The intention was to run each group for a month and then recruit new participants each month following. We started with 5 to 6 people per group with a waiting list. The sessions were facilitated by 2 community engagement staff and on most occasions joined by a popular Greek radio presenter and social personality. The opportunity to talk with others in their own language, hear how others are coping, and generally have some kind of social contact was invaluable. Importantly, this also gave us the opportunity to address any misinformation or questions people had about the coronavirus, the restrictions, safety measures, and more. And of course, to offer support and encouragement and where necessary, referrals. Many participants were followed up individually after the sessions for additional services and support. It was amazing how easily the group responded every time, and before we knew it, they were singing, believe it or not. There was laughter, there were stories, there was sharing of traditional recipes, including winemaking methods. And unfortunately, or maybe fortunately for us, we never got to do any of the tastings. But there was also pain and despair. Participants, however, felt supported and cared for. There was pain for us too, mostly to do with technology and its shortcomings. It was more challenging to manage the groups over the phone as we could not read body language or reactions, but manage we did, and the groups ran very successfully. We were lucky at the time we had 2 bilingual placement students who provided valuable assistance. They would call each participant prior to the session, to the phone session, to remind them and to check in with them. Soon we started running 2 additional groups connecting more clients. It was clear that some of the group participants were experiencing severe social isolation even before the pandemic. And some of the feedback we received was both heartbreaking and heartwarming. And here are some of the testimonials from 86-year-old Yanni. Sometimes I speak to the wall to make sure my voice works. And from 75-year-old Katina, this is the first time I have spoken about this to anyone. And Vicky, 80 years old, I can no longer do what I used to do. My life is very different now. We also received this testimonial from another person who called PRONIA to thank staff for the support she received. That was another aim of the support groups, was to get the participants in touch with each other so that they would ring each other in between the sessions and create new friendships and new support systems through this program. So Angela did call the office to let us know that she had been in daily contact with one of the other women in the group, which she valued greatly. And also she received counselling services, and she rang to tell us that her doctor had now recommended a decrease in her medication, which was a positive outcome. So once we were able to come to face-to-face sessions, so in between the various lockdowns, and in direct response to the lack of digital literacy, through funding and collaboration with Monash and Moreland councils, we established 3 digital literacy groups running in person every week, covering iPads or tablets and computers. In contrast to many other similar programs, our classes are conducted in Greek, showing clients how to access translated material on government websites and other important sites, as well as familiarise themselves with social sites and communication tools, which was really important during the pandemic when they couldn't see their children or grandchildren. And this way they had another tool at their disposal should they ever need it again. Digital safety was also covered. At times, external facilitators are brought in, but our Greek-speaking staff, as you will see in a minute, are always present to interpret and assist. And having seen the value and usefulness of digital devices during lockdown, clients are keen to learn how to use them, and we plan to bring these to more areas. In fact, we now have programs with 2 additional councils, Hobsons Bay and Darebin councils, and we will be starting new groups in October. And we continue to see collaboration through other councils as well to expand the programs to more areas. I'm going to attempt and show you this short video, which is one of the groups in the iPad session. They're actually learning how to take photos. So,
all right, so once you've taken a photo, to look at that photo, see how there is a tiny little square.
Εντάξει, Αντώνη σε πήρα λίγο κομμένο κεφάλι.
Και εγώ το ίδιο σε πήρα σήμερα. Να, κοίτα πώς έκανα. Δεν είμαστε εκτός. Για πρώτη φορά.
Λοιπόν, πώς θα πάρουμε τώρα τη φωτογραφία, για να δούμε.
The white one.
Εδώ μπορείτε να πατήσετε got it, that's fine. Μπορούμε να πάρουμε φωτογραφίες αυτό που βλέπουμε μπροστά μας, αλλά μπορούμε να το γυρίσουμε να πάρουμε φωτογραφία και από αυτή την
Ναι, αλλά πώς τον παίρνω με τον εαυτό μου.
Τώρα να το κάνουμε. Ναι, πολύ ωραία. We can do the reverse as well. Yeah? Τώρα θα δούμε πώς γίνεται αυτό λοιπόν.
And now,
so as you can see, we always have a Greek-speaking facilitator with the group as well, so that they can provide the translations needed. So going back to the support we provided through the telephone groups, as invaluable as those were, they were not enough. There was increased need for assistance in the community on all levels, and the pressure for the Family and Community Services Unit with limited staff resources was immense. Government programs and services did not meet the needs of many cold communities, and this gap fell to PRONIA and similar ethno-specific organisations to fill. So 3 months into the pandemic, in July 2020, PRONIA, with joined 8 other faith and multicultural organisations, with the aim of collaboration in delivering culturally appropriate support services to their communities during this time of crisis. And this became the Cultural Connections Consortium. The Islamic Council of Victoria was the lead organisation, and as you can see here is a list of all the other organisations, which was included PRONIA, African Family Services, the Australian Muslim Women's Centre for Human Rights, Indian Care, Jewish Care, Sikh Australian Support for Family Violence, Springvale Indo-Chinese Mutual Assistance Association, and Wells Women's for Women. The consortium secured a $2.3 million grant from the Victorian Government. This enabled the employment of additional 54 professionals across the 9 organisations for a period of 6 months. Just like the pandemic, this initiative was unprecedented and proved to be extremely valuable to all organisations involved. For PRONIA, this meant 5 bilingual multidisciplinary staff to deliver services in community engagement, mental health and wellbeing, casework, administration support and communication. And this was quite vital at the time to boost the team, the community, the family and community services team, in order to be able to provide services to more people. There were many programs that were initiated during those 6 months, and this is just some examples of promotional material produced in relation to these projects undertaken through the consortium project. So there were pamphlets, social media posts, newspaper articles, and more. And these were published in both Greek and English. Social media posts also became increasingly important. A very small number of our cohort who did use social media were able to access information in Greek, but importantly, second and third generation were able to, Greek Australians were able to access information or become aware of services available to assist their parents and grandparents. The Greek radio, print media also became very important and crucial elements in our communication strategy. This allowed us to disseminate valuable and accurate information in regards to COVID-related issues. Government information, both state and Commonwealth, had to be translated, and this was done by bilingual staff and communicated through newspaper articles and or the radio program. At that time, government information was not available in language, or at least not in Greek, and members of our staff would often translate material. Members of our staff were also later recruited to record announcements that were broadcasted on SBS radio, and information would then be circulated to the wider community, often painstakingly repeated by the telephone on a person-to-person basis, as fear and confusion continued to reign. Elderly clients struggled to understand what was going on, so they turned to PRONIA for information and advice. Another project undertaken this time was in collaboration with the Red Cross, the Outbound Wellbeing Initiative. Between October 2020 and March 2021, our staff made 2,374 wellbeing calls to Greek-speaking senior community members. Of these, 52% accepted to engage in conversation with our staff. The projected figure at the commencement of the project was that only 7% would agree to a conversation. Those who did engage in conversation did so for a minimum of 15 minutes and up to 40 minutes. The projected time frame was only 7 minutes. So clients spoke for at least twice as long as it was originally estimated, and up to 7 times more. We attribute this to the fact that the calls were made in Greek by bilingual workers and not in English as the program originally proposed. The response was a clear message that the need in our Greek-speaking community of seniors to connect was very real. 12% of those who accepted the call were later referred for additional services, either internally or externally to other organisations. So what have we learned? COVID presented many challenges over the past 2.5 years, and it's fair to say there are many challenges ahead. As much as we'd like to think that this is over, it's not. We know that it's not. Are we better prepared for a similar crisis? From our end, we're making sure that more of our cohort are equipped to handle digital communications. As mentioned before, our digital literacy classes are very popular and successful, and we have been slowly expanding the number of classes and the number of areas we cover. We need to ensure that there is local, state and national support to allow us and other CALD communities to deliver these programs in a culturally appropriate manner. This is really important. We have also seen collaboration with other COL communities is paramount. Without the Cultural Connections Consortium, it is very unlikely that PRONIA or any other member organisation would have been able to secure the funding that was so necessary to employ additional staff that was so vital in the delivery of culturally appropriate programs. The project was innovative and vital, and we're grateful to the state government that responded swiftly to the needs of COL communities, and we hope to see similar initiatives on a larger and national basis, not only for COL communities, but for other special needs groups as well. This is important so that we can continue to deliver services that are more than mere translations. And lastly, we want to see more training in engaging communities of culturally and linguistically diverse backgrounds to ensure culturally appropriate care and services are provided across the board. And we will be keen to collaborate with other organisations for secondary consultations, training programs, and more. In closing, I would like to say that PRONIA proudly continue to provide culturally appropriate services at this time of crisis, as it always had, albeit in a modified format. The services and programs delivered enriched the lives of our clients and supported them during very challenging times. Our staff were also challenged on a daily basis, but there was also a sense of pride and satisfaction in being able to effect positive changes in our clients' lives. And I would like to share with you this message from Stephanie, one of our reception staff, that captures beautifully the sentiment. From yesterday afternoon, I have answered many calls of thanks from our clients. Their calls have been full of emotion, gratitude, tears, and sincere thanks that PRONIA has thought of them, especially at this very difficult time. The good words and blessings that they have expressed have been truly moving. They wanted me to convey their heartfelt wishes to all PRONIA for Galianastasi and Galo Pascha. I would just like to say how very honoured and privileged I feel to be answering these calls. I'm able to spend a moment or two to receive their blessings, chat to them, and further convey our good wishes for a blessed Easter. These beautiful people have moved me to quiet tears of joy, gratitude, and thanks. And for that, I am truly grateful. Stephanie. Thank you for listening. And I think we've gone over by a couple of minutes, so apologies for that. Please feel free to get in touch. I've got my email on the screen, as well as the phone number and the PRONIA website.
Thank you so much, Lucy. Thank you for sharing your experiences. And I think it's unfortunately a little easy for those of us who weren't in the kind of, didn't experience the lockdowns to the extent that Melbourne did, to kind of to push it aside a bit. And I was so struck by the comment from the 86-year-old man, I think it was, who talked to his wall just to make sure his voice still worked. That will really stay with me. And I guess one of the really exciting things that we've learned from your presentation is just the power of collaboration and just how important that is. So thank you so much. I don't think we have any questions. Thank you all, and thanks again, Lucy.
Thank you. Thanks for the opportunity. Thanks, Robin.